next speaker is Claire Calderwood from Southampton. Claire is a medical student there. Welcome to Iclaf.
Thank you.
The title of her talk is Histone deacetylase inhibitor FK226 has potent anti-fibrotic properties in IPF.
So first of all, thank you very much for having me and inviting me to give a talk. As you mentioned, this is the work that I did as an undergraduate medical student at the University of Southampton. As we're all aware, there are currently no treatments for IPF that have been shown to improve survival, and therefore my project focused on investigating the potential of a novel potential drug, the histone deacetylase inhibitor FK228. Researchers in Southampton have previously shown that the HDAC inhibitor spirochestatin A inhibits proliferation and differentiation of fibroblasts from patients with IPF. However, our attention has subsequently shifted to looking at FK228, which is also known as romidepsin, since this drug is commercially available and licensed for use in certain cancers, and therefore would be more easily translated to an IPF therapy. Traditionally, histone deacetylase inhibitors were seen to have their effects by affecting the acetylation state of lysine residues on histones, promoting an open chromatin conformation, and therefore switching on genes. While some HDAC inhibitors do cause a non-selective increase in gene expression, drugs such as FK228 selectively affect class 1 histone deacetylases and therefore regulate gene expression over a relatively small proportion of the genome. Further, the genes affected might in turn repress or promote cellular processes. HDAC inhibitors are also now known to prevent deacetylation of other cellular proteins, especially transcription factors, in which acetylation affects nuclear retention and DNA binding. Overall, therefore, these drugs have the potential to modulate cellular activity more precisely than simply a global increase in transcription. One of the key pathophysiological events that characterizes IPF is formation of fibroblastic foci, in which highly activated fibroblasts and myofibroblasts differentiate and produce extracellular matrix, especially interstitial collagens. And this pentachrome stain shows the mature collagen in yellow and immature collagen in blue. My study investigated the potential of FK228 to inhibit proliferation and differentiation of myofibroblasts and production of extracellular matrix. In the interstitium, and after cleavage of terminal peptides, collagen forms fibrils due to spontaneous interactions between molecules. Stabilization of these by cross-linking enzymes, such as the lysyl oxidase family, produces mature collagen fibers with high tensile strength and resistance to degradation by collagenases. Lysyl oxidase is the prototypic member of the lysyl oxidase family and is a secreted copper-dependent collagen cross-linking enzyme, which is upregulated by TGF-beta. It's been implicated in a wide range of fibrotic pathologies, including those of the heart, lung, and liver. For this study, I hypothesized that FK228 suppresses proliferation, myofibroblast differentiation, and production of extracellular matrix by IPF fibroblasts. This was investigated by culturing parenchymal lung fibroblasts from patients with IPF and healthy controls under conditions which stimulated maximal growth, i.e. the presence of 10% serum-containing medium. The presence of TGF-beta1 mimicked a profibrotic environment. Fibroblasts were then treated with FK228 from 0 to 10 nanomolar for up to 7 days. Fibroproliferation was assessed using methylene blue uptake, while mRNA and protein expression with RT-qPCR and Western blotting, respectively. In the case of lysyl oxidase, this was measured in cell-conditioned medium, which was concentrated using stratoclean resin prior to Western blotting. At 7 days after treatment, FK228 potently suppressed myofibroblast proliferation in IPF fibroblasts, both in the presence and absence of TGF-beta1. TGF-beta did appear to confer a slight protection against the effects of FK228, with an IC50 of 0.14 nanomolars in the absence of TGF-beta and 0.71 nanomolars with it. Nevertheless, this is the potent suppression of proliferation at nanomolar concentrations. As apparent in the cell images, which were from an experiment using FK228 at its IC50 concentration, FK228 appeared to be cytostatic in these experiments, with little evidence of increased cell death. Interestingly, similar effects were found in healthy fibroblasts, where the IC50 was 2 nanomolar. Evaluation of the cell cycle inhibitor P21-WAF1 at the mRNA level revealed that FK228 upregulated this by 48 hours after treatment in both healthy and IPF fibroblasts. We found that these changes were paralleled by an increase in the amount of total acetylated H3 as a proportion of total H3 in cell lysate, demonstrating that FK228 was acting by its proposed mechanism. That's that. Alpha smooth muscle actin is a marker of the myofibroblast phenotype, induced, as shown here, by TGF-beta. Evaluation of alpha smooth muscle actin mRNA revealed that FK228 prevented this TGF-beta1 mediated induction at a 10 nanomolar concentration. Similar effects were seen with collagen, with increase with TGF-beta and suppression by FK228. Interestingly, these effects seem to be more sensitive to the effects of FK228 than the effect on alpha smooth muscle actin. Lysyl oxidase mRNA was induced by TGF-beta, as expected, whilst 10 nanomolar concentrations of FK228 suppressed lysyl oxidase expression, and this was to below baseline. When we looked at lysyl oxidase protein expression, we found that suppression of lysyl oxidase was seen in IPF fibroblasts with FK228 treatment, but not in the healthy controls. These data refer to active LOX protein because we found that under the conditions used, most pro-LOX was converted to active LOX enzyme. This was particularly true in the TGF-beta1 treated cells, where as well as an increase in active LOX expression, as you can see here, there was also an increase in proportion of active LOX conversion from pro-LOX. This graph shows the effect of 10 nanomolar FK228, both in the presence and absence of TGF-beta1, over 1 to 3 days. As you can see, lysyl oxidase accumulated in cell conditioned media over time, and this was prevented by treatment with FK228, which had a long-lasting effect, up to 72 hours after a single treatment. In summary, the depsipeptide HDAC inhibitor FK228 has multiple anti-fibrotic properties in IPF, inhibiting P21-WAF1 and therefore suppressing cell proliferation, as well as preventing the pro-fibrotic response to TGF-beta, suppressing alpha smooth muscle actin and therefore myofibroblast differentiation and extracellular matrix production. These effects were apparent at nanomolar concentrations of FK228, suggesting that this FDA-approved drug has a potent anti-fibrotic effect in IPF. As we've heard already this week, one of the significant challenges in developing IPF therapies is the lack of useful endpoints. One of the reasons which we included lysyl oxidase evaluation in this study was that we wondered whether, as a secreted protein, this might be measurable in bowel fluid and might represent a useful biomarker for measurement of FK228 activity in IPF. We therefore evaluated LOX expression in bowel fluid, comparing IPF subjects, which were kindly provided by Toby Mayer at the Royal Brompton, with healthy controls that had been collected as part of a COPD study in Southampton. As I alluded to earlier, when Western blotting for lysyl oxidase, two bands are apparent, both a 50 kilodalton pro-LOX band and a 32 kilodalton active LOX band. Densitometric analysis of the pro-LOX band revealed that this was upregulated in bowel fluid from IPF patients compared to healthy controls. Furthermore, active LOX was only detectable in bowel fluid from IPF patients and not in healthy controls. And it was detected in 12 out of 25 IPF subjects, compared to 0 out of 8 healthy controls. These preliminary works support lysyl oxidase as a biomarker of IPF, which is sensitive to FK228 treatment. However, obviously significant further work is required. In light of the fact that some of the subjects analysed were low LOX expressors, we are working to develop a panel of biomarkers which might be used to evaluate FK228 activity in IPF. I'd like to thank my supervisors, Professor Donna Davis and Dr. Kate O'Reilly at the University of Southampton, as well as Lizzie Davis, who did the preliminary work on FK228 and spirochestatin. Also, our collaborators at the University of Rochester, who are working on the in vivo aspects of FK228, and at the Royal Brompton Hospital in London. Thank you for listening. I'll try and answer your questions.
we have time for several questions. Joe?
I have two questions, since there's several.
Can we get a mic over there?
Is the FK228. I've seldom encountered an HDAC inhibitor that doesn't inhibit other HDACs. So in addition to HDAC7, what other HDACs might this inhibit? That's the first question.
So it's specific for class 1 HDACs, so that's HDAC 1, 2, 3, 7 and 8, I think. So there's several within that class. Does that answer your question?
The second question.
Other questions? Luca.
Congratulations, it was an excellent job. Well done. So there was anything different in the 12 patients with expression in the bowel fluid as compared to the other half? It looked like 50% again, 50%. Do they have any clinical or age or presentation difference?
Not as far as we've managed to elucidate yet, but we haven't got all the clinical follow-up data for the patients which I analysed. And it's quite a small group as well. So.
Other questions? Okay. Thank you very much.